Before starting my exam on my patient here, I will have the appropriate PPE, gloves for sure. As I approach the patient for this normal pediatric assessment, I'm assuming this toddler will be in mom's lap or something like that. Our mom will be close by, mom or dad. Um, as I approach the patient, I'm just looking at their overall general appearance, their work of breathing, skin color, things that I can see without touching them, their affect, their mood, their like facial expressions, how they tracking me, um, before I start asking questions and identifying myself and stuff like that. So with it being a toddler, I would expect the child to have eye contact with me. I would assume they would be very uh, wary of strangers and things like that. Me being a stranger, they've never seen me before, so I wouldn't expect them to have eye contact with me and answers like questions appropriately. But if it's like a school age child, I would expect them to look at me in the eye and understand like certain things that I'm saying, like I'm Jacob, I'm a paramedic. What's going on today? What brings you here? This and that. I would have expect them to have a certain response to that. Um, that's appropriate, but um, if not, that's okay too. But I would introduce myself anyway to me, to mom, and the child. I'm Jacob. I'm a paramedic. I'm gonna do an assessment on you. I'm gonna be touching you a little bit, poking you around a little bit. Just making sure you're okay. All right. So after I would get my general impression, I would note anything else abnormal, um, assess for their mood and responses and things like that. I would get a normal set of vital signs. Start with like non-invasive stuff first, like I guess I do like a sat monitor on them. I'd feel for a pulse, carotid, brachial, radial. Get a blood pressure on a toddler. Might not be as needed as just like a cap refill, and things like that. A respiratory rate, I would calculate. Tidal volume, depth and effort, rate, depth and effort. Um, a SAT, a temperature. Um, for this normal assessment, probably not a BGL because they're going to be assuming they're healthy. And not a known diabetic. Temperature, pulses, blood pressure, SAT. After I get my vital signs, I'd go straight to a head-to-toe assessment. So I'd say, I'd let mom know and I'd let the child know, I'm going to be touching you a little bit, okay? You tell me if anything hurts or if anything feels funny or different, okay? So I would assess the child's head first, assessing their scalp. After I look at the skin, just in general, if I can't see any obvious like abnormalities, rashes, bleeding, stuff like that, I would assess the head, the scalp, the hair, make sure it's well kept or not. I would touch their facial bones, their head, their cranium, making sure I don't feel any abnormalities or anything like that. I would assess their ears, make sure there's no drainage coming, no redness, infections that could possibly be occurring, no excess um, wax in the ears, things like that. I'd assess their eyes, visual acuity, have my pen light, make an H, have them follow me. For a toddler, that might be difficult to do. I can pull a stuffed animal or a toy of theirs and have them look at your toy as I go up and down just to test their visual acuity. I'd also ask them how many fingers I'm holding up or something like that. I'm assuming a toddler can count to 2 or 3. Check their pupil responsiveness, noting the color of the eye as well, any redness, any drainage, like crusties in the eye, things like that. I'll assess the nose as well, look inside the nose. Do I see any obstructions in the nose? Do I notice any excess drainage coming from the nose? Dried mucus, snot, blood from the nose, excess snot inside the nose. Assessing the mouth as well, looking inside, having them say ah, so I can look inside their mouth, make sure it's pink and wet and moist. Noting the upkeep of their teeth, things like that. Do I notice any like cavities or just awful smells and stuff like that? Assess their jaw as well. Have them bite down. Assess their jaw tension. Have them see if they can open their mouth without any issues. I'd assess the neck as well, noting the trachea and the jugular veins. Then we can move down to the chest, exposing the chest. After telling them, of course, I'm gonna lift your shirt up for a second, okay? Look at the chest, size, symmetry, and shape. Any obvious open or closed wounds that I can see. Palpate the chest. Have them take breath in and out. They'd probably already be breathing, but I'd feel anyway. I'd get lung sounds, all three spots, vesicular, bronchovesicular, and then posterior as well. Also could check trachea sounds as well. Get an apical pulse where I listen to the heart and check their pulse, see if it sounds the same. S1 and S2 sounds. And then move down to the abdomen. Do I notice any obvious distension, discoloration? Noting the size, shape, symmetry, open, closed wounds, scarring, things like that. Palpate on the abdomen. Could have fun with it. Poke them, see if anything hurts. Just noting their response to just me poking them. After that, I go to the back. Feel the spine for any step-offs or anything like that. Just noting any obvious injuries or open, closed wounds, discoloration, rashes, things like that. Then I go back to the front, go assess their pelvis. I'm going to push on your pelvis real quick, okay? So I push on the pelvis, just knowing the stability. Wouldn't assess the genitalia unless they had a specific complaint that the parents wanted, you to check out or something like that. So then I'd go to the legs. I'm assessing each leg, size, symmetry, and shape. Make sure they're both the same size. Any obvious scarring, open or closed wounds, things like that. Rashes. Are they cold? I want to test their CMS as well. Check popliteal pulses and pedal pulses as well. To test their range of motion and things, I'd have them kick out their legs. I could also have mom sit them up and stand them up, and have them walk to mom to note if they can walk or not. Also palpating as well, asking if anything hurts when I touch. Feeling, see if I feel it, if it's cold or anything like that. Then I go to the arms, do the same thing with the arms. I'd ask them to hold their heads up, see if they can hold their hands up to the side and in front, like circles, things like that. Wiggle their fingers. Palpating brachial pulses and radial pulses as I palp downward. You can have them wiggle their toes. Check CMS as well, or their fingers. Check CMS as well. Looking at the nail beds as well. Do I see any obvious, are they excessively dirty or not kept up right? Are there any obvious injuries to the arms, open or closed? Noticing the size, symmetry, and shape, things like that. And then, yeah, that's that.